Good morning, everyone.
Keep the timer for 5 minutes, please.
The title of our study was the comparative evaluation of AIOS2025 parameters in patients of angle closure disease versus normals. There is a wide variation in the reported prevalence of PSEG in India due to a lack of gonioscopic evaluation. Quantitative imaging modalities such as UBM and AIOS2025 provide an objective method of evaluating the anterior chamber angle, which can help in the early diagnosis and timely treatment of glaucoma. Our study aimed to evaluate the anterior segment anatomical parameters quantitatively in angle closure disease spectrum using AIOS2025. Our objectives were to compare the AIOS2025 findings in angle closure disease spectrum with normals, to assess any quantitative differences in the different stages of angle closure disease, and to study their possible correlation with the gonioscopy findings. It was a tertiary care hospital-based cross-sectional comparative study over the course of 1 year, and the patients included were either diagnosed as PACS, PAC, or PACG, aged more than 40 years, and patients with gonioscopically open angles and relatively small refractive errors with no other ocular abnormalities were taken as controls. The major exclusion criteria were any previous glaucoma procedures like a peripheral iridectomy, previous ocular surgeries, or other ocular abnormalities. Patients were recruited from the glaucoma and general ophthalmology services after an informed consent. Comprehensive systemic, ophthalmic, and glaucoma workup was done. Patients were classified as PACS, PAC, and PACG using the European Glaucoma Society guidelines, and age-matched patients with open angles were taken as controls. Both eyes were included if eligible. Ocular imaging was done using the angle-to-angle scan mode and the chamber view image of Cirrus HD OCT via single technician masked to the clinical and gonioscopic data. The angle opening distance 500 and 750 microns, trabecular iris space area 500 and 750 microns, trabecular iris angle 500, and lens vault were measured. Poor quality images such as those with indeterminate scleral spurs were excluded. A total of 204 eyes were included according to the sample size, 46 eyes each in the PACS and PAC group, 45 in PACG, and 67 in the normal group. There was no statistically significant difference in the age or gender distribution between the groups, other than a higher prevalence of females in the PACG group. Coming to the gonioscopy findings, significant difference was observed between all the groups except between the PAC and PACG group. This slide shows the AIOS2025 findings of patients in different groups, and as we can clearly see, the angle gets progressively narrower in the advancing stages of angle closure disease. The measured AIOS2025 angle parameters, angle opening distance measured 500 and 750 microns from the scleral spur, showed a significant difference between all groups except the PACS and PAC group, with the least value in the PACG group. A similar trend was observed for the trabecular iris space area 500 and 750, with the least value again in the PACG group. The trabecular iris angle 500 microns from the scleral spur showed a significant difference in all groups other than the PACS and PAC group, with the least value in PACG. The lens vault was also measured using AIOS2025, and a significant difference was found between all groups, with a progressive increase in the mean value in the advancing stages of the disease. Coming to the correlation matrix of the various AIOS2025 parameters and the gonioscopic angle grading, the Pearson correlation coefficients obtained suggested a high degree of correlation between the two parameters. So to conclude, the AIOS2025 parameters show a statistically significant difference in the angle closure disease spectrum patients compared to age-matched normals, as well as across different stages of angle closure disease, except between the PACS and PAC. The lens vault was highest in the PACG group, emphasizing the role of lens thickness in angle crowding. AIOS2025 parameters strongly correlated with the gonioscopic angle grading, reinforcing its reliability in assessing angle width. The Van Herrick's grading also was found to be a useful screening tool to differentiate angle closure from open angles. So while gonioscopy remains the gold standard, advancements in anterior chamber imaging offer an objective and reproducible approach to diagnose angle closure and future developments such as deep learning algorithms with automated imaging analysis could further enhance diagnostic accuracy. Thank you.
Thank you, Dr. Abhyuday. So, was this being done at a specific lighting condition where you were testing this, or was that variable as well?
Yeah, it was done in a semi-dim lit room.
All right. And the reliability indices for all of these were kept at high, right?
Yeah.
Okay. So this is otherwise it's a good finding to have, though as you said, gonioscopy continues to remain the gold standard.
Yeah, the question is, what was the basic purpose of comparison of OCT angle changes in the primary angle closure disease? What is the basic purpose? Because PACS you said is not significant. So main thing is the PAC suspect cases that you have to see whether it goes into angle closure or not. That you have said is still open.
Sir, we found a significant difference between the open angles versus the angle closure spectrum, including PACS. So it can help in diagnosing the patients who are missed on gonioscopy. But as we found in the study, no significant difference was found between the PACS and PAC group. And so
your main aim was to diagnose between POAG and PACG.
Yes, sir. Open angles versus any angle closure suspects which are usually missed.